All right. Hello, everyone. My name is Alexis Wait. I am a second-year Master of Public Health student, Peace Corps Coverdell Fellow, and Outreach Assistant Intern at the Pacific AIDS Education and Training Center, or Pacific AETC, in Arizona. Today, I will be sharing the work that we do at the Pacific AETC by discussing the Arizona 2021 HIV STI TB Clinical Update. Before we dive in, I would like to disclaim that although this presentation is supported by the Health Resources and Services Administration, or HRSA, this PowerPoint presentation does not represent the views of the United States government. So the Pacific Education and Training Center of Arizona is a local partner of the Pacific AETC, an organization funded by the Health Resources Services Administration, or HRSA, and is based at the University of Arizona College of Medicine. We focus on education and technical assistance for clinicians looking to increase capacities in the treatment and prevention of HIV. We work with organizations, clinics, and local and state health departments to build capacity among medical providers across the state to increase access to high-quality preventative and HIV care for all Arizonans. And my project took place from August of 2020 to May of 2021 with the support of my preceptor, Britt. The Arizona 2021 HIV STI Tuberculosis Clinical Update took place on April 13th, 2021. And this project offered a free 4-hour virtual training for healthcare providers that was held to share 2020 surveillance data, updated clinical guidelines relevant to human immunodeficiency virus, HIV, sexually transmitted infections, STI, and tuberculosis, TB. And for this event, continuing medical education credits were provided. In partnership with the Arizona Alliance for Community Health Centers, Arizona Department of Health Sciences, AETC, Curry International TB Center at the University of California, San Francisco, and the California Prevention Training Center, the Pacific AETC convened a planning committee to develop, discuss, and tailor the annual HIV STI TB clinical update to the needs of Arizona healthcare providers. And as the lead coordinator for these meetings, my role was to create meeting agendas, schedule meetings with the group, review training materials, develop and disseminate promotional materials, make edits to training materials to meet accessibility requirements of event funders, compile evaluation data, and so on. Additionally, I developed the event agenda and collaborated with speakers to make a speaker bio page to be shared with the event participants as well. A total of 180 people from 19 states and 3 countries registered for the event. 94 of those registrants were from Arizona. On the day of the event, 179 healthcare professionals were in attendance, 76 of which were from Arizona. Physicians, pharmacists, nurse practitioners, social workers, case managers, and people from many other professions joined us for the event. All right, so of those who attended the event, 102 people completed an evaluation. And here are some of the findings from evaluations that were given to the participants. Only one person stated that they do not plan to use HIV prevention knowledge and skills gained during this training. 89% of the participants agreed that they would be able to interpret statewide STI surveillance data and explain trends in recent years to identify at-risk persons. 88% of the group said that they would be able to demonstrate how to diagnose, manage, and treat disseminated gonococcal infection, or DGI, to improve patient outcomes. 90% said that they could discuss current recommendations for monitoring patients on pre-exposure prophylaxis, or PrEP, to ensure efficacy, safety, and prevention of HIV and other STIs. 76% said that they could explain injectable HIV therapy for patients, and 89% said that they would be able to apply the 2021's clinical recommendations on latent tuberculosis infection, LTBI, testing and treatment to community health settings to improve clinical reasoning skills for proper care and management of LTBI. Overall, 73% of participants agreed that they would seek additional training after this event. Participants stated that they wish to have future trainings on HIV basics, challenges in rural and low resource settings, care that is specific to transgender and elderly people, and how technology can be used in HIV care or HIV-related services. As a result of this training, 76 healthcare professionals from 10 out of 15 counties in Arizona have received training to improve their capacity to provide preventative care for HIV, STIs, and tuberculosis. The educational and technical trainings offered by the Pacific AETC of Arizona would not be possible without the community partners that worked behind the scenes and facilitated the trainings. The trainings are not only to provide continuing medical education credits to healthcare providers, but to pursue the overall purpose of creating organizational capacity building among healthcare professionals for an inclusive, safe, and knowledgeable environment for patients receiving care. I made a variety of contributions to this project and other projects at Pacific AETC, but this one was one of my favorites. This project taught me to pivot due to COVID-19 pandemic, to take leadership, to plan ahead, and taught me new skills like developing accessible flyers and presentations for our participants, the importance of networking, and so on. I would like to thank my internship preceptor, Greg, and the rest of the HIV STI TB Clinical Committee for welcoming me to the team and providing me support throughout the internship. I would like to thank my mentor, Dr. John Ahiri, for supporting and trusting my endeavors throughout this project. I would also like to thank the Western Region Public Health Training Center, Pacific AETC, and the University of Arizona Melanie-Sacrament College of Public Health for their support. Finally, I would like to recognize that the University of Arizona is located on the Tohono O'odham Nation homelands and the lands of the Pascua Yaqui tribe. Thank you. If you would like to have any more information on the Pacific AETC, please follow this link to their website. And here are a couple of resources to the Pacific AETC website and the Western Region Public Health Training Center. And finally, if you have any questions at all, please do not hesitate to send me an email and I'll see if I can answer them for you. Thank you so much.